Thank you so much, everybody. Thank you. Thank you so much, everybody, for joining us on your Tuesday afternoon. We really appreciate you spending this kind of time with us. I'm Avantika. I'm a senior program manager here at WomenLift Health, the India office, and I'm joined by my colleagues, Prachi and Sanaya. WomenLift Health, firstly, I think we're very excited to kind of offer a space where we can together get to reimagine leadership with the WomenLift Health alumni. For those of you who know and for those who don't, WomenLift Health India Leadership Journey is designed to provide mid-career women working in health in India with the tools and strategies to enhance their voice, leadership, presence, and influence, while being supported by a powerful group of peers, mentors, and coaches. We are now, as you know, accepting applications for the 2024 cohort, and the applications go on till 18th of December of this year. In this live Q&A session, we are joined by the WomenLift Health alumni from the inaugural, so our first 2022 India Leadership Journey, Priya, Sapna, Randhoni, and Prabhdeep, and they'll be introduced in just a minute. Priya Nanda, in particular, is our alumni lead, and she will be supporting in moderating today's Q&A session. So we're very excited for that. Priya Nanda is a health economist with expertise in research, evaluation, and grant making on gender, women's economic empowerment, and sexual reproduction, health, and rights. Her expertise and interest is in understanding approaches to rights-based programs and policies with a focus on gender and structural inequalities. Until April this year, she led a research and evaluation grant-making portfolio as a senior program officer with the Bill and Melinda Gates Foundation at the India country office. Just before I hand over to Priya, I do want to just put some housekeeping rules. The session is structured in a way that it's split into two. So we're going to have a moderated discussion with Priya and the panelists for about 35 to 40 minutes. The idea is for them to kind of share their experiences from their leadership journey in the 1 year that they spent with us. And the second part is a live audience Q&A for 15 minutes, which is where all of you come in, where both the WomenLift Health alumni and staff will take questions from the audience about the leadership journey experience, program details, and the application process. Feel free to type your questions into the Zoom chat. Your questions can be sent in through the session, but they will be addressed during the Q&A session at the end. I know some of you mentioned that you're speaking and you're not being able to be heard. It's because this is a webinar. Everybody is muted for now. We will try and see if we need to unmute you in the end. Otherwise, put your questions in the chat and they will be taken in the end for sure. The WomenLift Health staff will directly respond to questions regarding program details and the application process in the Zoom chat so that we don't take up panelists' time for the same. Thank you again for being with us. This session is being recorded, just so that y'all are aware. And I am now going to hand over to Priya, our moderator. Thank you so much again for being with us. And thank you, panelists, for taking out the time for this.
Thanks a lot. Thanks a lot, Avantika. And good afternoon and welcome, everybody. It's very exciting to be here today to talk about our ideas around women's leadership as we are the first cohort of WomenLift Health's India journey. We are 4 of us here, and I'm now first going to introduce 3 of the panelists who walked this journey with me over the last year. They come from diverse backgrounds of public health in India. We have Prabhdeep Kaur. She's a professor, Isaac Center of Public Health, Indian Institute of Science in Bangalore. She's a distinguished physician and public health professional with close to 2 decades of extensive research and work in teaching and implementation science. And as the scientist and head of division of non-communicable diseases at the National Institute of Epidemiology in Chennai previously, she led and played a pivotal role in training field epidemiologists in India. We have Randhoni Lairikyengbam, Assistant Director of SATI. She leads programs on promoting universal access to health, legal and social services for marginalized populations, particularly those affected by HIV/AIDS and coming from diverse gender and sexuality backgrounds and identities. And she's committed to advocating for justice and equality for LGBTIQ+ communities in India. Sapna Kedia, our last panelist, is the Assistant Director, Gender and Social Development at the International Center for Research on Women. Her work focuses on men and masculinities research, sexual and reproductive health and rights work, as well as gender governance and public policy. She's also the founding member of Women in Global Health India chapter and works in collaboration with other chapters across the globe. So just very briefly to situate the panel, most of you who are in this webinar today know that research has consistently shown gaps in women's leadership. And particularly, it shows that women's leadership is slow, staggered, punctuated, and deeply affected by restricted gender norms, issues of safety mobility, pauses due to maternity, lower salaries, and gender division of labor. But most importantly, two additional facts that research has shown up is an imposter syndrome where women tend to undervalue their own accomplishments and the lack of access to networks that men organically have at work, often referred to as the old boys network. So these gaps show up a lot in our own conversations around women's leadership and have been subjects of discussion in our own journey over the last year. Today, using that as a context, what we'll share is a little bit of our experience in the next 30 minutes of understanding what women's leadership means and how that has shaped our journey last year. So I'm going to start with Sapna. Sapna, you at ICRW are actually researching women's leadership. You're doing research on that and have been through this journey yourself. What was the understanding you came into the program with about women's leadership, and how has that evolved with your own journey over the last year?
Thank you, Priya, and it's a pleasure to be here. It's really, really nice to talk to potential cohort members and answer their questions. I was thinking about my journey before WomenLift Health and how it sort of influenced me. One, I think, my idea of what a leader is, who a leader should be, was absolutely based on masculine notions. I have grown up in a family filled with men, so very strict schedules. You have to be at office at a certain time. You cannot take breaks. They would pride themselves as not attending any family functions and always working and being very, very assertive at the workplace. And by nature, I'm not an assertive person, so I would always see myself as not a leader because I would think, oh, I get bullied. I don't really, it's easy for me to get influenced by people. I am not so systematic about my work. I need breaks. I need mental health days off, and so on and so forth. And then during the course of the Women Lift Health journey, there was this whole assessment in the beginning of how our peers and people, our colleagues, our seniors, people we've worked with, look at us as and our work and whether they see us as leaders. And I was so surprised that most of my peers and people I've worked with thought that I'm a leader, and they thought that the very same qualities that I thought don't make a good leader, they thought made me a good leader. Like, for instance, uh, giving breaks or taking breaks or being compassionate or not being so strict, not being uh, very hung went on accountability, keeping flexibility, so on and so forth. So I think what happened with Women Lift Health, and which is what we've also found in our research, Priya, is that honestly, this whole notion that we all grow up with, that, oh, you're born a leader and leaders have to be like this, leaders are like that. I think through our research and also through the Women Lift Health journey, I think what I've really, really learned is that you're really not born a leader, you become one. And leadership and leaders are not one kind. Leadership can be different for different people. People respond to different kind of leaders. So that's one. I think the second thing, Priya, based on my experience, is that I also started demanding, I mean, not accountability, but I also started noticing green flags, red flags in the leaders around me. Earlier, I would be easily impressed and all of that, right? I wanted to do everything as per the leaders around me. But then this journey helped me take a step back and be like, hey, I don't think that's the right way to lead. Or hey, I don't think that I necessarily want to lead in that particular manner. And it also made me be able to demand the kind of leadership that I deserve and people under whom I can work with. So I would say that Women Lift Health made me see myself as a leader, and it also made me think of leadership as something that hasn't doesn't have to be boxed. It can be fluid, it can be authentic, and there are days that you don't feel like being a leader, but you may still be a leader. So I think it sort of eased me into thinking of myself as a leader.
So very quickly, to just challenge you a little bit before we move to Randhoni. So you are saying that everybody has manifest leadership and it's very fluid, but some people get positions of leadership and
Yes.
others don't. And women are disadvantaged increasingly in that space. So are there any reflections from what you just said on accorded positions of leadership?
Yes, absolutely. Um, there are so many barriers, right? And women don't have easy access to leadership. And women's leadership, even if they're leading within projects, within spaces, it's not even seen as leadership. Leadership is really the very visible male kind of leadership, position based, right? But very often within organizations, within public health systems, our own health system, where community health workers are leaders in their own rights, they're just not recognized as leaders. And the barriers, one, is that very often women's work is taken for granted. Whatever women do at the workspace, it's seen as an extension of their womanhood. I think that's one big barrier. The second, workspaces don't account for the fact that women every second of the day are dealing with gendered norms, right? They are dealing with norms of care, responsibilities, elderly, child care. They're dealing with norms of reaching home on time, so on and so forth. Workplace don't account for that. They may have policies, they may not. But if they have those policies, very often when women use those policies, if I was to take a maternity benefit break, right? And it's my right, it's my legal entitlement. But the workspace becomes a space where I'm judged for being away from work and where there are no measures to reintegrate me back into the workspace. So
So
structuring back, yes,
yeah, no, so we're going to come back hopefully to
yeah.
this point. So I just want to emphasize what you're saying is that there are accorded positions of leadership and there are intrinsic
Yes,
aspects of leadership, and we need to recognize both,
yes,
especially for women who get disadvantaged in the accorded positions of
yes,
leadership, right? Randhoni, I'm going to move to you now. You in conversations earlier, we know that you've been working a lot in building voice and constituencies for marginalized groups at Sathi. Um, and you've reflected on how this journey has helped you understand leadership and your own leadership in a very different way. So could you talk about that a little bit?
Yes. Thank you, Priya, and thank you to WomenLift Health for this platform where we can talk to the like aspiring women leaders. So talking about a bit of my work, like I have been for more than 10 years working for the rights and inclusion for marginalized communities, wherein gender and sexual minority communities are also one of them. And my focus right now is working for them and for their rights. And being a cis woman myself, I mean, I have been able to relate to them, to relate to their sufferings and issues. So when I started the Women Lift journey, I mean, I have been recommended by my management to be part of this journey. And I also started to think that, okay, I am in such a role that I have to build people, I have to build my own community whom I'm working for, as well as I have to build the strength of women, because being a woman myself and being able to work for the marginalized community, I took up or I challenged a type of leadership project in my journey wherein I included women at the grassroots level, the frontline health workers, to be part of this inclusion movement. Talking about the inclusive health for the LGBTI people, because sometimes we are not even able to talk about ourselves. But if you really understand the issues or the problem of another individual, you are actually in a position to tell or talk more about them. So we started working with the frontline health workers, and in that process, we were able to see that many of them who had been working with us, who had been trained by us, or who had been oriented by us, they were able to talk to the local people in their own locality about the issues of this gender non-conforming children or gender non-conforming persons. And they were even able, they're coming forward. I mean, the frontline health workers were able to come forward with like trying to link them to services. Even if they do not know which services to be linked, they were contacting us, and then they were trying to figure out a way wherein the support is provided. So in that way, I was kind of able to see that like being inclusive, is very important if you want to, work for the betterment of a certain marginalized community. And that was what I was able to see. And my journey has also helped that. And as also Sapna mentioned a little bit, the assessments that we actually went through during the start of the journey. And when we were able to discuss the result of those assessments with the coaching sessions, with our coach on a one-on-one basis, that was really, really very helpful to know myself better professionally as well as personally also. Because in the beginning, like I was having a lot of tension in work because I was thinking that everything was on my plate. How will I be able to carry on this? As well as WomenLift Health journey was also a one-year journey with the calendar set out that you will be having sessions. I was a little overwhelmed at the beginning, whether am I going to do justice or not? But then slowly the journey was very, very, it was very enjoyable, as well as it was very, we learned a lot of things. So the coaching, actually, I want to give a lot of thing for the coaching, which has helped me to bring effectiveness in my job, on and off the job. I was able to divide the time properly. Earlier, it was everything running together. At home also, I'll do office work. So those things I was able to kind of figure out how can be best handled. But the coaching was what that has helped me to, think over. A lot of personal talks also happened between the coaching, which has really helped me. Yeah, Priya.
Great. So I also want to emphasize something you talked about. I think you didn't kind of label it, but it's something which is that everybody, the point that Sapna was making, that everybody has intrinsic qualities of leadership, and all your frontline workers manifest that. And, we know that, we say it on paper, but to actually start seeing that and affirming that is really important. And I do think the leadership journey really helped all of us kind of identify that and start seeing this much more clearly than probably, earlier it may be more bookish understanding of this. So, Prabhdeep, you actually occupy institutional positions of leadership in your work. You all have for a while. So can you talk about, given that you already did have that, what has been the transformative impact of WomenLift Health for you?
Thank you, Priya, and thank you, WomenLift Health team, for this opportunity to share the experience. So I think I agree with my previous panelists who have highlighted very important issues, and I'll add on to that and not be repetitive. I think one of the most important thing which I learned was the importance of big picture. I think quite often we all get lost in our technical work, and we just think that we have to be very good at it. But then you realize that as you move from technical to leadership positions, the context, the whole ecosystem matters, the networks, the strategic thinking. So what I feel that this whole journey was designed in such a way that it provided us insights into importance of these things. So I think just moving from that very technical to a broader way of looking at things and giving importance to, for example, like I never realized that networking was so important, and we had a full session on it. And we realized, many of us realized in that session that, no, we used to think, why should I go for this meeting? I would rather, finish some other work, right? So how these things kind of add up over a period of time, and women tend to underemphasize them. And overall, building the ecosystem. So that was one, I think, dimension of leadership, which I had not reflected so much on. That, it's not just about doing certain things, but just creating that whole ecosystem. And especially if we want that, not just us, but the future younger women should be able to flourish. What kind of ecosystem we need to be creating? What is normal? Like, I think Sapna mentioned that the definitions of normal might have to be revisited, right? So it's okay if people want to, take breaks, or, sometime prioritize their children, sometime. And quite often I have seen in my own teams that women feel very guilty when they do all of that, but they don't have to. So I think these were the kind of reflections we had. And of course, when we redefine that ecosystem, it does mean that we have to let go a lot of the assumptions that have been put into our head. And I think what helped in this journey was the fact that we were not just theoretically learning it, but we were talking to a group of other professionals, and we were a very diverse group. And then we realized that, some of these are commonalities, and what we can learn from each other and embrace in our own workplaces. Thank you.
Yeah, no, it's very interesting. I think what you also said is that how we undercut ourselves often in our own leadership spaces, right? I mean, and that's somewhat similar to the idea of undervaluing your own achievements. So if, the imposter syndrome, as we're talking about it, is that we tend to kind of undersell ourselves in all of these spaces, which doesn't mean that you have to oversell or overstate yourself, but it just means that you have to show up and just imagine that this space is for you and you deserve it. Like, there's just a very graceful way to kind of accord yourself that position of leadership. And also, and the idea that Randhoni was talking about is to include others, to be really inclusive in that. So I think that really is, in a way, in an interesting way, summing up how we would define women's leadership for ourselves as a group, perhaps, So I think I see some questions which are much more practical, but before I go into those, I wanted each one of you to talk about one really big aha moment for you about your journey, like something that really was special about how you connected with this idea of leadership, and one question or challenge that you still have, like something that still is not resolved for you. So let's start with Sapna. We go in the same order.
Thank you, Priya. I think a big aha moment, like I earlier shared, was when I actually sat down and I felt like, oh, I am a leader. I think due to WomenLift Health, I think for the first time in my life, I acknowledged to myself that I'm a leader. And I think that was very, very powerful and helpful to me. I think also what the other thing that stood out for me was trying to think of myself as a mentor. Very often, because, and you spoke about the imposter syndrome, Priya, very often because of that, we think, oh, we are lacking in this, we are lacking in that. But we're also working with a lot of other people, team members, women, younger people, even elder people. And very often, people unconsciously or consciously absorb a lot from you. So I think with WomenLift Health, I also understood that I'm a leader, but I'm also a mentor, and what kind of spaces I create around me for vulnerabilities, for being accountable, for also being kind, compassionate, and for demanding changes from the system. So I think these two things would be very, very important for me. I think the challenge that continues is this deep seated imposter syndrome, Priya. And I think that will take a lot of years of unlearning, but I think the beginning is a recognition of it.
Great. So, Randhoni, same questions for you. You can build on what Sapna said or your own reflections.
Yeah. My aha moment, I would say, is like immediately after we completed the journey, I was kind of involved in contributing to an opinion ed, which was like a contribution by WomenLift Health and one another women organization to write something about the need for health of the LGBT people. It was during the Pride Month, June 2023. So our discussion started from May, and the happiness was that not writing about the LGBT in that thing, but a women-led kind of initiative that is trying to be like very open and like that inclusive thing, which is actually a passion for me. Is it came out in the form of a way that I could contribute in that writing, and I contributed to that. So that was my aha moment. Another aha moment is, if I say at the beginning, when I met with all the 30 of us, we were all so very different, yet so very common also. That was an aha moment also for me, how different we were at the same time, how common we were at some issues and in all our challenges and difficulties. Yeah, I'll make it very short because I'll give time for others and more on the discussion and questions.
Okay, sure. Prabhdeep?
Yeah, again, I'll be quick. I think, yeah, for me, it was just meeting so many brilliant women and learning about their journeys. And I think the best was when we met. Actually, we didn't meet in the beginning, right? Unlike our junior cohort, which has met. We met in the end, and that was the sad thing. We should have met earlier. But when we met, and there was a structured program, but I don't think that was the aha moment. The aha moment was our evenings when we just listened to each other's stories and journeys. And I think it was started by Priya, or she asked me or something like that. And then it just went on. And for 2 days, we were just listening to each other's journeys. And that was just very, very powerful. That has stayed with me. And it just made me realize that, there are just so many amazing people out there, and we should get strength from each other and make this tribe grow. And the challenge, the challenge. Yeah, the challenge is just helping other women. I think the social norms are just so powerful in our country, and the assumptions are just so strongly embedded in people's minds there because their upbringing and the environment, everything. And when you try to tell them otherwise, I find the women just find it so hard to accept it. Like if you tell them, no, you can do it. I mean, they're like, no, but I can't, or whatever. Or, these factors are going to kind of stop me, or I should not be aiming too much because I'm a woman, because I have kids, because I have this, because I have that. So I find it extremely challenging. Of course, sometimes people who work with me, like, they're like, they may find it a little difficult because I really push them hard. I'm like, no, just because of women that you should never think. So you have to do it. And over time, some of them do feel, that it's good that they were pushed. But I think in general, I find that is very difficult from a mindset perspective. Thank you.
So before we move on to questions, I just want to share my reflections very quickly. For me, like Prabhdeep, I just was like totally wowed by the kind of talent and the women that were there. I mean, everybody was so special. And it just was overwhelming that how little we knew about each other and all our contributions to science, medicine, public health, social development. So that I think was a big aha for me. I think the challenge is still the fact that the two little things, when women get to the top, they've had to fight so hard that it's sometimes not easy to relinquish space for others. So I think this idea of being inclusive and mentoring and bringing others along with you is a really important practice. It's an everyday practice. as you all have noted. And the second is that, it doesn't have to be, the top doesn't have to be a spot for one person. It can be a spot for many women together. And I think that power of the collective is really, we talk about it in our work with other women, but somehow have not really experienced it ourselves. And I think this was the beginning of that experience. And it's still, we still need much more opportunities for that. So with that, Avantika, I have one optional question which kind of addresses some of the questions of the panelists. So I may ask that. So Sapna, Randhoni, and Prabhdeep, your leadership project. So if you can just quickly, don't tell us about the project, but just talk about, were you able to use your institutional mandates and work as your leadership projects? And two, if you did that, just say that, yeah, it was possible to do that, and just how difficult was that to balance your leadership project with your full-time work? So just very briefly, if you can talk about that. And one specific question was whether you could use your institution's ongoing work as a leadership project. So I think, Sapna, you were doing that, right? And
Yes.
so was Randhoni. Yeah.
Yes,
So
yeah.
why don't
I
you
was
just
also doing
talk? Yeah.
So no, definitely you can use your organizational affiliation. And in fact, my organization supported that, and that's why they nominated me to be a part of the WomenLift Health journey. And that made my investment into the WomenLift journey greater, because it was my leadership project was a part of the everyday work that I was doing. It helped me push my boundaries on that, but at the same time, given practical constraints of time, so on and so forth, it was a good balance. So you can definitely do that. I think in terms of the challenges, I think what would happen is that our sessions, our WomenLift Health training sessions, touch points was so intense, and those 2 hours, 3 hours would be so intense, and you would enjoy, you would think about different things. And then after that, immediately you would switch gears and attend other meetings, move from here to there, and get so caught up that you would only then, in the next touch point, come back to feeling that you're part of the journey. And I think that perhaps was the case also because, like Prabhdeep said, because we were mostly an online cohort and we met towards the end, I think that disassociation was a challenge. But in the end, I think it worked out well.
Randhoni, build on this and also talk about how you strategically selected your goals for your leadership project so you could achieve it, like if you can just talk about that.
Sure. Yeah. So as I was talking, we have been building capacity for healthcare providers also on issues of LGBT. So as an extension of that capacity building, we thought, or I took the help of my seniors before I put it here as my project. And I put forward the frontline health workers as an extension of my healthcare provider sensitization. So I could use the rapport that I had built up with the chief medical officers in the district headquarters to get the time and the slot and the thing for sensitizing the women. So that was a very good opportunity for me, and I definitely have used my institutional kind of engagement to further my project. Yeah, and
Prabhdeep?
in terms,
Okay,
in terms of challenge, for the project, I did not find any type of such very challenging thing that I could not address. Yeah. Thanks.
Yeah. I think for me, my networks came handy. I used my existing networks to do my project, and it wouldn't have been possible without that, because it was actually, because I was working with kind of people who are already at some level of leadership position whom I would not have been able to access, but for my position. So definitely my institution was very supportive. My director was very supportive. And whenever I took time to either attend sessions or do whatever related to WomenLift Health journey, I was definitely able to do only because my institution support was very good. Yeah, thank you.
Prachi, do you want to add something here?
Yes, Priya, thank you. Prabdeep's already got that. But what we wanted to say here was that 100%, unless there's a buy-in from an institution or the network that you're using, it won't go as far. Because you're going to be doing this project by yourself. So it's great that you have the institutional buying and the networks that you've been working with for quite some time, because one thing that the application and also the journey that will focus on would be your own circle of influence. So 100%, having all of that really helps.
On the other hand, I wouldn't let it completely dissuade you if you didn't have full support or you were an independent consultant, working more singularly. So, I think don't be so overwhelmed about the leadership project. It's an important part of your journey, and you will learn skills and learn things that will help you adapt and shape that to be more suitable. So what you set out may not be exactly what you do, and that's fine. I mean, it's really the journey of the project is also the same as your journey. So, just at least my experience was that I didn't choose anything that was an institutional mandate. And it was something that I had been thinking about for a very long time. And I may not have gone very far by the end of the journey, but I'm still thinking about it. It's still an important issue, and I've made networks around it. So, it's an important issue that others are now also helping me think about. So I think it varies from different people. And I think you're absolutely encouraged to publish. In fact, there's a session that you will have with the experts from, a premier peer-reviewed journal who will do sessions on writing and publishing. So you're absolutely encouraged to publish. Randhoni already said she wrote an op-ed coming out of her journey. So have I. And others too have. So I think absolutely you're encouraged to publish. So and let's talk about mentorship. There's a question around mentorship. We all got somebody who was a very senior person in the field who was our mentor, and we also additionally got coaches. So does anybody want to reflect on this, the idea of having mentors and how that facilitated or helped you?
So I think if no one is saying, I'll say a few lines. So I think the mentors were usually people who have walked that path. So the discussion with mentors really were very realistic. So it was like saying that, okay, you've been in this situation, I'm in this situation. What do you think or how did you handle this sort of situation with your subordinates and so on? So I think they were very realistic, grounded experiences which were discussed in the mentoring sessions. And also, unlike the contact sessions where we had less time, I mean, there were bigger groups, and then we also go into these breakout rooms where we have smaller groups where very deep discussions happen. The mentor, because it's a fixed group of people who keep coming together, so you also develop a kind of relationship, and you kind of are able to open up easily because you are repeatedly connecting with the same group over a period of 1 year.
Absolutely. So I just want to say, like, the mentors have a very specific role in the journey. They help you really refine your thinking, especially around your project, be maybe sometimes more practical, sometimes they'll connect you to people. If it's a research project, they may advise you on the research methodology. It could be anything, but I think their role is to help you with your project. And the coach is very much about your own personal journey, your own personal challenges. There's a large 360-degree assessment that's done, and that gets discussed in the beginning, and then the coach, helps you with your particular, and it's very, very unique to your needs. So both things are very helpful. There is somebody who's asked about whether, nuances of women's leadership around, being in women-heavy and women-led organization versus other organizations. Do such nuances of women's leadership get discussed? I would say yes. Anything that you bring to the table as your question or your challenge or your experience is open for discussion. And every question and every personal story and experience benefits everybody else in the cohort. So the journey is very much facilitated to bring, there is of course some kind of a structure, but if that structure only holds true because you are the one who's filling the content and shaping your experiences within that structure. So that's very important, I would say. Avantika?
Yeah, thank you, Priya. I also just wanted to invite some of the folks who've been asking a bunch of questions on the chat. And I know
Sure.
Soumya has also raised her hand. Gaithan, if you can help with unmuting, maybe Soumya, since her hand is raised.
Soumya, I've just sent you a request to unmute. It should appear as a pop-up on your screen, so you can unmute and ask your question.
You can also type it in, Soumya. Don't worry
Yep.
about it. Type it in, we'll call it out and we'll answer it as well.
I think the others are also welcome to raise their hands. If Soumya is unable to talk at this time, I see Gauri's also raised her hand.
Yeah.
I'll just allow you to talk.
Thanks everyone. This has been a great session. So my question is around the leadership project, which all of you already discussed. But since the idea is to focus on improving outcomes at the intersection of health and gender equality, I've been thinking about it in terms of my work. So I work in the space of safe surgery and anesthesia. So I would like to focus on that. So is it again like important to bring the gender lens on this issue if I have to choose my project?
I think there were 3 or 4 topics which were given, and I don't know if it is still same, Prachi. So there are 3 or 4 areas which are very clearly mentioned, and you can pick a topic and then map it to one of those broad areas. So it's quite broad.
Yeah.
It actually incorporates most of the things you may want to do.
Yeah. And I think more generally, Gauri, yes, your projects have to be at the intersection of public health and gender. So it should ideally be touching on some aspects of gender as you're kind of navigating what issue to work on your leadership project. So to answer your question in short, yes, it should be at the intersection of both. We do have certain themes that we put out as part of leadership projects. You can move out of those themes. So we don't necessarily tell you to fit everything in those 4 themes. But the idea is to give you some kind of direction in which you can think. And those 4 themes, I think, maybe eventually we can send it to you or Prachi. I don't know if you want to share it right now as part of the application process. Yeah.
I also wanted to say, Gauri, there's almost nothing where gender is not relevant. So I could sit with you and help you bring a gender frame to your idea, or anybody here could. So I mean, you just have to have that lens. That's it. So I wouldn't worry about it too much. You can also, I mean, that's where, somebody can help you if you're really passionate about what you want to do.
Yeah, I would say to be very specific, Gauri, the 4 areas that we work in is, of course, the top one is the centering, in no particular order, centering women and girls in the project, catalyzing institutional change, optimizing pathways to leadership, and lastly, building integrated and resilient health system. From what I hear, the work that you do on the face of it looks like it would fall into the building integrated health system category. So you can always affiliate it with that. Having said that, no project always sticks to one theme. There's always an intersection and an overlap. So, and these 4 categories are broad enough to, I think, fit actually anything and everything that all our applicants write about. I am also going to be in the chat posting a brochure or a pamphlet kind of a thing that we have about the leadership project, which is up on the website as well. It has all the details about the leadership project. So anybody who has more questions can actually refer to this one.
Somebody else, Panchali.
Yes, Panchali, I'm just going to unmute you, and I see that even Bhavya has asked a question in the chat box. So I'll first unmute Panchali, and then we can maybe take Bhavya's question.
Yeah, hi. Good afternoon. I actually joined this session on a whim because I've been following Women Health on LinkedIn, and I see all of you speaking a lot about it, but I have been glued to it for last 1 hour. So thank you so much for the interesting discussions. I have one question, which is more regarding the eligibility. I mean, I have around 18-20 years of experience, out of which 10 years has been in food industry. And at the age of 38, I decided to do my PhD and get into academics and research. And for last 7-8 years, I have been thoroughly working in the area of public health research and academics. So do I fit the bill of 10 years of eligibility of being in the development sector, or I don't know, I'm just asking it, should I be putting in my papers in this for this position or not?
I can answer that for you, Panchali. So I think we definitely encourage you to apply.
Okay.
I think the reason why we insist on spending 10 to 20 years in public health is because even your peers, in some sense, kind of come with that kind of a background, and then you're kind of able to provide that kind of a support system to each other. While we do encourage you to apply, I think we'll have to kind of see what the eventual group looks like. And then take a call. And if not, you'll definitely be hearing from us on whether you should wait another year to apply so you can fit the needs of the group. Because we also don't want you to lose out in the process of being part of the cohort. So for you to be able to give, but also be able to learn from your peers. But by all means, I would say give it a shot.
Okay, great. Thank you so much. Thank you.
So there's a question for the panel. Which is about how can leaders or heads of organization help increase women's labor force participation in India, which continues to be low. So I'm going to ask Sapna to start that, and then if others want to add, and then I might have some thoughts. So Sapna, want to go first?
I think first is the intent. I mean, everybody keeps talking about women's labor force being low, right? So whichever heads of the organizations, whichever sectors they are working on, I think we have to figure out the root causes of women's low labor force participation in that particular sector as a whole, yes, but the organizations, the sectors that they work in, we have to figure out the reasons and have the intentionality to address those. And a major barrier, as we've been saying again and again, is gender norms that restrict women's participation. So how willing are organizations to take that extra step to address some of these issues that prevent women from getting into the workspaces? Are they going to provide flexible working conditions? Are they going to provide menstrual leaves? Are they going to provide work from home facilities? Are they going to work and push towards making equitable pay policies? So on and so forth. So I think the very direct answer, which is very difficult to crack, is that organizational heads need to be committed to addressing gender norms within workspaces and figuring out what they can do to ensure that when women come to work at the workspaces, they don't have to constantly deal with the issue of double burden and feel guilty and then leave the workspace. So what are you doing as an organizational head to ensure that women stay back? I think that is an important aspect to consider.
Randhoni, Prabhdeep, any thoughts and reflections from you on this question?
Yeah, I think I agree with Sapna, and policies play a big role, I feel. See, I worked in central government, and it seems historically, like when you look back at data, the most central government departments used to have very low proportion of women employees, at least, especially, in the positions that matter. And policies like, maternity leave and childcare leave, especially 2-year childcare leave was introduced sometime, I think around 2008-9 or something. And I know it hasn't had a huge impact. Like, I know there are women who have joined the service after that saying that, no, I took it because I know I can take leave whenever my child is sick or, some family issues are there. So policies matter. And then I think enabling environment, which each one of us can help. Actually, I realized that wherever we are part of, whatever institution we are part of, once that there is an image that this is a safe place for women to work, I feel you get a lot more women applicants whenever the positions are advertised. So that image, that is it a women-friendly work environment, makes a huge difference. And then thirdly, I think the difficult part, which Sapna also mentioned, is actually our social norms. To just, first of all, get women to even apply for these positions, then when they apply, stay on those positions and then grow. So there are many points in this journey when they sort of tend to, somewhere go off the charts. So social norms are important, and I don't think we have an answer to it, but we need to keep working on it from every aspect that we can, in our families, in our social circles, in our networks, in our workplace, and so on. Thank you.
So I agree with Randhoni also. Randhoni, did you want to add anything?
No, Priya, please go ahead. Go ahead.
Okay, so I just wanted to say that both Sapna and Prabhdeep have talked about what institutions need to do, and then government's role in regulations and policies. I think that's all very important. But I would also say, if you make spaces gender friendly for work and institutions work gender friendly for work, like all of these issues that have to be there, but there has to be an intention to say. And I think we need to create standards. Like, there was a time that, we started to buy environmental friendly products, right? So we have to create standards in industry, in governments, to say we actually work and we are hiring in gender friendly spaces for women. And I think as we keep doing that, the norms will change. And it's really essential that we hold accountable institutions that have large female workforce, or institutions that have very low female workforce, but could be hiring more women on either side, to be having better work and family-friendly policies for women. I think that's really important. And the government, of course, has a role, because it has to be also mandated from the top, and institutions need to be held accountable for that. And lastly, I mean, if you increase wages, and create different standards of jobs that women can be hired into and recruited into, and you give them attractive wages, chances are the economics will outdo the norms, and more women could be entering the labor force. So we should really be addressing the wage gap too. And those are standards that can be created not only by industry, but also by government. So I think it's a really important issue. Obviously, a lot of women's organizations tend to hire women and support women, and we need to do that. But remember, we also need inclusive workspaces. So it can't just be only women. Like, I think a lot of organizations that are working on gender issues are actually trying to be much more democratic and inclusive, and that's good. We need the same to be done for more traditional mainstream institutions as well, industries, corporates, businesses, manufacturing. Like, we need much more of that, these standards to be for industry to be held accountable to.
And I think, just to add, Priya, I think women also should demand that in workspaces. I think women, whichever workspace they are in, I think we also should demand. We should push that. We should make things a little uncomfortable.
Be disruptive. Okay, over back to you, Sanaya.
Thanks. Thanks so much to the panel. I think we have one last question from Shweta, after which we'll close. And I see that we're almost on the hour at 5 o'clock. So if we can keep this super quick so that we don't spill over too much. So Shweta, if I can ask you to unmute yourself and ask your question. Hi, Shweta, are you there? Okay, in that case, Shweta, have we lost you?
I think Shweta also had a question on the chat, but I couldn't fully understand it. I was trying to answer it. Does it have an adverse impact if the category in which I present my project does not coincide with the one that's perceived? I think, Prachi, you answered it, that you could put
It's
it slotted in.
self-identified. Yeah, we don't categorize it. When you're filling the application, you fill in the category. Sometimes it's overlapping. That's my understanding of that question, actually. So I answered it like that.
Okay.
If there's something else, Shweta, then we are happy to chat about it.
Okay.
I think there are many questions around the eligibility criteria.
Yeah.
Number of years and so on. You may want to clarify some of that.
Yeah. We've clarified, I think, most, but I think the latest one that I see is from Deepika, who has 7 years of experience and a PhD in public health. Deepika, please feel free to apply. We look at PhD as work experience as most international organizations. So we'd be happy to accept that application. So go for it.
Okay, so just before I give it back to you, Sanaya, thanks to my fellow panelists and to WomenLift Health to invite us for having this conversation. It was really fun to relive for a short time our experience of women's leadership. And back to you, Sanaya, over to you.
Thanks so much. Thanks, Priya. Thank you, Prabhdeep, Randhoni, and Sapna for joining us and sharing your experiences and your insights. Thank you to all the attendees for a lively discussion. We really hope that we were able to answer your questions and that you are excited and geared up for submitting your applications, and maybe looking forward to more discussions of this nature once you are a part of the WomenLift Health community in India. So just to close, I think a few calls to action for all of you. If you'd like to learn more about the 2024 India Leadership Journey and apply, we'll be pasting the link to the application webpage where you can learn more about eligibility criteria, access the brochure which talks about the leadership project, and basically go through the details of the program. The application deadline is December 18th, which is, I think, around 3.5 weeks from now. So we encourage you to get started soon. We are also, a big priority for us is to create a safe space and a network of women leaders who are working in public health in India. And I think that LinkedIn is a great platform for us to create that network. So do connect with WomenLift Health staff, reach out to us, connect with the alumni on LinkedIn. And as Prachi said, if you have any further questions, you can write to us at indiajourney@womenlifthealth.org, and we will get back to you as soon as we can. That's it.
Thank you. Thank you, everybody. Thank you, Priya.
Thank you, everyone.
Thank you,
It was
Simon. Thank you.
Very
All the
nice.